Hello. It is my honor to be here with you today. I know that for so many of us, as you've probably discussed, today is a very dark day. Today, the United States Supreme Court stripped away a woman's right to choose. But more concerning to me is that this is not simply about one simple procedure or a simple discussion. It is an assault on women and our ability to control our lives and our freedoms. It is about our ability to control our bodies. It is about our health. And today's event, today's conversation looks at the conversation and the necessity of putting women, especially diverse communities, front and center when we are talking about healthcare. I was recently having a conversation with a cancer survivor. She was telling me about how it was difficult for her, how when she discovered that she had been diagnosed, it was a surprise to her, but it was also a question of whether she'd be able to afford the treatments that she needed, whether she could afford the time it would take to recover. And we know that for too many women, the issue of survival is not one of theory, it is one of everyday reality. And that is why SHARE is so critical to our community and why this conversation is so essential to who we are and who we intend to be. I am standing for office in the state of Georgia because I believe in healthcare. While SHARE focuses on the necessity of serving communities diagnosed with women's cancers, my experience is with my father. My father had prostate cancer 15 years ago. The service he was provided did a little bit to help him, and we were proud when he went into remission. But it was a few years later that my mother noticed that he was having challenges, that despite following the regimen, going to his post-op and going to see his doctor, he was getting sicker, but no help was coming. And it was because the methodology they were using to diagnose my father was wrong. It did not understand the necessity of thinking about Black men's cancer treatment different from women, different from white men. And because of that, my father actually faced not only the return of his prostate cancer, but it had traveled to his lymph nodes. We caught it in time, but that was because my mother knew to look. She knew to ask questions. She knew to ask hard questions. But for too many of our communities, those questions go unasked because they don't know they have the right to raise those concerns. And they don't have the language to use to describe what they need. They don't have access to the doctors who could answer those questions. And for too many of our communities, the disparity in access to healthcare, the inequity in healthcare coverage and in access to care is a death sentence. Whether it's from poverty or lack of access to nutritious foods, whether it's about stable housing, reliable transportation, or simply the disconnection between the humanity of the woman seeking help and the decisions of those providing services, too many of our women are facing challenge, facing cancer, and facing death without having the kindness that they deserve. In the South, in the rural South in particular, this is incredibly acute. Georgia is one of those states that has failed to expand Medicaid. We have said to our communities, especially our rural communities, you are on your own. It is not because we don't know the answers, it's because we refuse to answer the questions. We refuse to make the smart decisions that can save lives. Medicaid expansion is a cornerstone of providing access to quality, affordable healthcare services to not only support physical well-being, but the mental well-being that helps you know that more is possible, that recovery is possible, that surviving is possible. And it's also about having the financial security to make it through to the other side. My goal is to expand Medicaid in the state of Georgia because I know it works. In 38 states that have expanded Medicaid, they have seen their cost go down, their outcomes go up, they've seen communities thrive, and they've seen people survive. In the state of Georgia, the expansion of Medicaid would create 64,000 new jobs. It would save rural hospitals. It would create opportunities for 500,000 Georgians to get access to the healthcare they need. And it would create the space for more healthcare clinics, for better telemedicine, for the recruitment of doctors and nurses and other medical professionals that can save lives. Medicaid expansion is the answer, and we know it because the numbers tell us so. Medicaid expansion has been associated with improved rates of cervical cancer screenings. Women die without that information. And if they cannot go and seek screenings, they will not get service. We know that individuals enrolled in Medicaid prior to their cancer diagnosis have a better survival rate than those who enroll after their diagnosis. And if we want to get ahead of the scourge of cancer, we've got to get in line and expand Medicaid in Georgia and across the 12 states that refuse to do so. We know that Medicaid expansion leads to an increase in both total and early stage cancer diagnosis, because in those expansion states, preventative care is a part of the process. In those states that have expanded Medicaid, communities know that they can go and ask for help when they see the first sign of trouble. They know they can find a doctor, get an answer, and get the treatment they need. But the gap in diagnosis between expansion and non-expansion states is widening. If you are in a state that cares enough to expand Medicaid, your survival rate is going up. And if you are not, you are being condemned and you're being left behind. I know what is possible in Georgia if we are willing to do what's right. And I know how vastly important it is because I live in one of the most diverse states in the nation. Right now, the population of Georgia is 52% white, 33% African American, 11% Latino, and 4% AAPI. We know that these are the most diverse communities and their outcomes also matter, that the outcomes differ depending on their demography, but it should also not be dependent on your geography. Georgia should get it right. We know that we cannot get it right if we do not do the right thing, and that is expand Medicaid to serve every one of these communities. But we also know that the pandemic has caused a challenge with healthcare workers. We know that for so many of them, they've experienced burnout and depression, anxiety. They have chronic conditions that are going untreated. And unfortunately, we know that this means that they are seeking alternative opportunities. We have shortages in Georgia that are not singular. We know that across this country, new healthcare workers and longtime workers are facing challenges, and that those who provide healthcare services are facing shortages. We must recognize that hardworking healthcare professionals have dedicated their lives to supporting everyday people, and that their agreement to provide support should be met with our agreement to invest in their well-being and in their welfare. We have to acknowledge that since February 2020, the healthcare industry has lost 306,000 jobs nationwide. And here in Georgia, 4 in 10 of the counties in our state have no general pediatricians. Half of our counties have no OBGYNs, and half have no psychiatrists. We know that when there is anxiety, when there is depression, when there is hopelessness, that cancer survival goes down. And we know that when people feel supported and invested in, survival rates go up. This is not an academic conversation. This is an existential conversation. And I bring it back to today's decision. We know that the decision that has been made by the US Supreme Court to eviscerate 50 years of access for women will have a direct impact on cancer screenings. You see, I live in a state where we are already facing shortages of OBGYNs, the very necessity of deciding if we can catch some cancers early. But without those doctors, without believing they can see those doctors, because doctors are going to leave because they face incarceration for providing medical services, we are going to face extraordinary hardship in Georgia. And sadly, we are not alone. Across the South, this decision is going to not only impact a woman's right to choose, it is going to impact a woman's right to live. Cher has done extraordinary work raising these conversations, but we cannot allow ourselves to be siloed. We have to recognize that the decision about healthcare, the decision about a woman's autonomy, the decision about our bodies is a decision that cannot be made in isolation, and it cannot be made for us. We need good people to stand together and to demand action. We need to remember that the people providing those services need our defense, because it will be those healthcare workers who risk their lives and their livelihoods to help people get the healthcare they need. And we need to recognize that every time a woman is diagnosed, every time a person is diagnosed with a woman's cancer, if they have access to adequate resources, if they have access to information so that they understand the signs and the symptoms, they have a better chance of survival. This is who we should be. I'm standing for office because I believe in our future. I know that my father is still with me after 15 years because good doctors made better decisions. But I know he's with us because my mother had the ability to have conversations, had the information to know what to look for, and had the resources to find the solutions. But my parents should not have the privilege of surviving while so many others do not believe they have access and opportunity. I am running and I am standing and I am fighting because I believe that healthcare is a right, that surviving cancer is a right, and that if we will do right, we can do better for all. Thank you so much.